Okay, so let's talk about a few myths about Invisalign. One of them is that it only treats simple cases. It can't target difficult cases. Now, we do want to be obviously selective in the types of cases we have. In this case, the patient did not want to do traditional braces. He's well into his 50s and he doesn't want to be an adult on braces. So we did talk about doing Invisalign. He knows that we're going to do our best to get the teeth in the proper position. They don't always express perfectly, but we do get them definitely in a better position than what they originally were with. So this is how he started. This case actually expressed really well, but we just had to work well with the technicians to make sure that the teeth move at a certain position. He was in these trays for 510 days, so that's about 18 months. So this is how it went down. And sometimes midway through the case, we do have to stop and rescan if we feel like the teeth aren't expressing well, especially when there's such large movements that are happening here. But we got him into this position, and again, he's at 480, and these are just correctionals if needed at the end, especially if it's a big case. But we get him to a position where now we can restore this crown and maybe do a gingivectomy, which is like lifting this gum just a little bit so that it can match its neighbor right here. And then we'll do restorations. As you can see, his teeth are pretty worn down. So because of how his bite was, he did wear down this tooth to become this short. So we definitely want to do some type of coverage on this, whether a veneer or a crown, depending on how much decay. Hopefully a veneer, because we want to be conservative. We have to work with the bite, obviously, and make sure we lift some of the bite so that these crowns have space. Again, this is going into restorative, but we're in a harmonious position to start doing restorations, such as crowns. When we're here, there's just too much going on and too many teeth cascading and hitting directly against each other that you can't put a crown or a veneer on this. It's going to fracture right away. So that's kind of the thought process behind this.